I'm Mark Newison. I dedicate my time to the treatment of patients who have vascular problems. I'm a vascular interventionalist, and all my time is truly dedicated to the management and treatment of patients who have complicated vascular ailments. Looking back at the history of the cardiac program at St. Luke's Medical Center, the program has always been extremely strong here, and I think patients have recognized that over many years that St. Luke's is a hub for treatment of very complex cardiac issues from a surgical standpoint and more recently from an interventional standpoint. I'm very fortunate to be part of a team of specialty physicians that include invasive cardiologists, non-invasive cardiologists, vascular surgeons, cardiothoracic surgeons, imaging physicians who have expertise in CT scanning, echocardiography, etc. Because altogether at St. Luke's Medical Center within Aurora, the cardiovascular program is truly dedicated for the betterment and the care of patients who suffer from cardiovascular problems. As a result of the integration of all the specialties that I've talked about, surgical and interventional, I truly believe that we are a very attractive program in general for the companies to come to us so that we can participate in their investigational trials, prospective trials that will ultimately lead to the development and the marketing of better devices to better serve our patients. We have access to the latest investigational device that deal with aortic valve stenosis, for instance, that have become almost a percutaneous technique of treating this very complex issue. We have access to stents, stent grafts to treat complicated thoracic aortic aneurysm. And of course, we've been also performing aortic aneurysm stent grafting for many, many years within this integrated program. All of us, all the participants who have their very specific focus. But what's so attractive and what's so important for me to observe is that every one of them, every one of us really has the passion, and we are truly dedicated to making our patients' outcome better. I think an important observation to be a part of a program such as this cardiovascular program is that you realize that all of us is smarter than any one of us. And it's not unusual that 2 or 3 different specialty physicians will actually team up to solve a problem together. In having that approach and being part of a strategy that allows us to function like that on a daily basis as a physician, I truly believe that we can impact on the outcome of patients and make our patients better. I work very closely with the very best invasive cardiologists. I work very closely with the very best vascular surgeons, and I work very closely as well with the very best cardiovascular surgeons. So we have a rapport, and as a result of that, I truly believe that we are equipped with far better tools to tackle complicated issues where all of us are smarter than any one of us. And because of this integration of the different subspecialty, I'm also very convinced that we are a very attractive entity to perform clinical trials and to test investigational device for treatment of complicated aneurysms, for instance, treatment of complicated aortic valve issues. And quite frankly, we are more and more having access to such devices because the companies do recognize that our organized, dedicated platform is truly dedicated to better patient care, and as a result of that generates far better outcomes.